So, hello everyone. I have just finished my class this morning and it is at 12 o'clock. Yeah, so I make the videos immediately for you. On the previous videos, we have talked about how to find the suitable food for you and your family, also is for yourself, and some way to see the ramifications between the sadness and depression. But today, our main topic will be the COVID-19 disease. So recently, many areas on this country in Vietnam people has get vaccinated and a lot of people. So the question is, how can we produce vaccines quickly? Now the story will begin. Put your headphone on and enjoy the best volume qualities as you wish. So in the 20th century, most vaccines took well over a decade to research, test and produce. But the vaccines for COVID-19 cleared the threshold for the emergency use in less than 11 months. The secret behind this speech is medical technologies that's been developing for decades. The R, the mRNA, the mRNA vaccines. These new treatments use our body existing cellular. It is hard work, you know. Let me tell it again. This new treatment use our body existing cellular machinery to trigger an immune response, protecting us from the viruses without ever experiencing an infection. And in the future, this approach might be able to treat new disease almost as quickly as they emerge. So, how do these revolutionary vaccines work? The key ingredient here is in the name, mRNA, or messenger ribonucleic acid. It is a naturally occurring molecule that encodes the instruction for producing proteins. When our cell process the mRNA, a part of a cell called a ribosome translates and follows these instructions to build the encoded protein. The mRNA in these vaccines work exactly the same way, but scientists use the molecules to safely introduce our body to a virus. First, researchers encode trillions of mRNA molecules with instructions for a specific viral protein. This is a part of the virus and is harmless by itself, but helpful for training our body immune response. Then they inject those molecules into nanoparticular roughly 1,000 times smaller than the average cell. This nanoparticle is made of liquids and the same types of fatty materials that form the membrane around our cells. But these liquids had been specially engineered to protect the mRNA, and each journey through the bodies and the seed is entrance to the cell. Lastly, the final ingredients are added, sugars and salt, to help keep the nanoparticles intact until they reach their destination. Before use, the vaccines is kept at temperatures of minus 20 to minus 80 degrees Celsius to ensure none of the components break down. Once injected, the nanoparticles disperse and encounter cells. The liquid coating on each nanoparticle fills with the liquid membrane of a cell and release the mRNA to do its work. And at this point, we should note that while vaccines is delivering viral genetic materials into our cells, it is impossible for these materials to alter our DNA. mRNAs are short-lived molecules that would never additional enzymes and chemical signals to even across our DNA, let alone change it. And none of these DNA altering components are present in mRNA vaccines. So let's continue. One side, the cell, the ribosome translates the mRNA instructions and begins assembling the viral protein. In the COVID-19 vaccines, that protein is one of the spikes typically found on the virus surface. Without the rest of the virus, this long spike is not infectious, but it does trigger our immune response. Activating the immune system can be taxed on the body, resulting in fatigue, fevers, and muscle soreness. In some people, that is the side effect. But this doesn't mean the recipe is sick. It means that the vaccine is working. The body is producing antibodies to fight that viral protein, and will then stick around to defend against the future COVID-19 infections. And since this particular protein is likely to be found on most COVID-19 variants, these antibodies should produce the threat of catching new strains. This approach offers significant advantages over previous vaccines. Traditional vaccines contain quicker versions of live virus or amputated sections of a virus, both of which require time and intensive research to prepare, and unique chemical treatment to safely inject. But mRNA vaccines doesn't actually contain any viral particles. Particles. Yeah. So they don't have to build from scratch to save just each virus. In fact, every mRNA vaccine could have roughly the same list of ingredients. Yeah. Imagine a reliable, robustly test vaccine that can treat any disease by swapping out of a single component to treat a new illness. Researchers would identify the right viral protein, encode it into an mRNA, then swap that mRNA into the existing vaccine platform. This could make it possible to develop the new vaccine in a week and give humanity flexible new tools in a never-ending fight against disease. So I have told you about the technologies how to produce the vaccines. So you know what? Many vaccines now all over the world use these technologies to produce vaccines, and let me see, it is a strain vaccine. So let me remember the name of it. The AstraZeneca vaccines, COVID-19 vaccines, is one of the types that use the mRNA technology to develop. That is the reason why the AstraZeneca COVID-19 vaccines is very cheap. It is cheaper than the other kind. One dose is only about 2.4 USD. Yeah, and you know, what do you know about the effect of it? Let me tell you. AstraZeneca COVID-19 vaccine provides up to nearly 90% of protection against the causative agents of COVID-19 based on clinical studies. Yeah. So how does this function? I will talk more about this. AstraZeneca COVID-19 contains a genetically modified virus that causes the common cold. The technologies of mutated virus has been successfully tested and applied in creating vaccines for other diseases. AstraZeneca COVID-19 vaccines help the body develop the immunity preventing the causative agents of COVID-19. Yeah. Different vaccines will have different effects on the body's immune response. But one thing in common in how vaccines work is that in addition to creating antibodies against the virus, Vaccine can also create T lymphocyte and memory B lymphocyte to fight invading virus in the future. So that is our talk. So that is the main point about the COVID-19 um, vaccines and about the mRNA technologies. That's all. Thank you for your listening.